Hi.
I'm Dr. Clark.
Hi, I'm Lorena Billings.
Lorena, nice to meet you.
Nice to meet you too, Dr.
Now, what are you interested in, Lorena?
Well, what I'm interested in is as you can see, my acne scarring. I grew up with scars. I mean, with acne my whole life. Same typical thing. I scratched my acne, so it made it worse. And for the result of that, I had some scarring. And I believe was when I was younger. My mom said I had some type of, I don't even remember, but I think these are kind of deeper than the regular scarring.
You may have had a viral infection or something when you were young.
Yeah, I believe so. And I was just like at it, scratching and scratching.
Have you ever had any treatment or any experience with lasers?
I had what I believe when I was in my 20s. I had really bad acne, so we went to this surgical guy. They said he was good, and I had kind of like a peeling, like a really major peeling, because because I remember afterwards my face was really red, but also what he did, he cut me. He did like this mini lift. Which was, I didn't know if he was supposed to, but I didn't know any better. Right. My dad was just like, I don't care.
How long ago was that?
That was I was in my 21 years old, 22. I'm 39 now, so it's been a while.
Okay.
And also in Mexico, I had some, I believe what I call some fillers. Because I remember I had kind of like a cut right here from the acne, but I remember they're doing some fillers, but I don't.
Okay, well, all those treatments are still done today. They're still good treatments, actually. We have here, I have 2 different laser treatments.
Okay.
That will smooth your skin, shrink the pores.
Oh, okay.
Will soften any fine lines.
Oh, good.
These are resurfacing treatments. One's done with a erbium resurfacing laser that's called a Venus laser.
Okay.
The other one's a Fraxel laser. It's fractionated laser that's put on a little bit different way so you won't peel.
Okay.
The first one I mentioned is a laser peel. Now, I have all different strengths and all different ways I can customize these treatments depending on how many treatments you want, how much downtime, well, it's not really downtime, but how much redness you want to have. So this will all vary depending on which treatment you select.
Okay.
Both treatments are very excellent treatments for smoothing.
Okay.
And if you ask my clients to rate one over the other, it comes out to be about 50-50.
So it doesn't matter.
So it's hard to say. Some people do one of one laser, and then they'll do another one with the other laser.
Okay.
And we have a lot of clients that do that. Now, I like the erbium resurfacing laser. That's my favorite laser because I've been doing it much longer. I've been using that laser about 8 or 9 years. Fraxel really has only been out about 3 or 4 years.
Yeah.
I mean, really clinically. But it's good, and they both do a lot of smoothing. And they'll shrink the pores, and the downtime isn't really downtime, but you will be red depending on how strong the treatment is from both of those. Either you can be red for 1 day, or I can have you red for 4 or 5 days.
Okay.
Only the first night you'll be a little uncomfortable. That night you're going to be hot no matter what. And you won't want to be near anything warm. You want to be in air conditioning.
Right.
Now, I have clients that go to the golf course.
Hot already.
But I have clients who've gone to the golf course right after the treatments. They
Oh,
put
wow.
on a ton of sunblock and moisturizer and wear a hat, but that's not what we recommend. You'll probably want to stay in that night after the treatment.
Okay.
The next day, you'll be red. We'll be giving you moisturizer with sunblock in it during the day, and at night you use the moisturizer without the sunblock.
Okay.
And then depending which laser you do, 3 or 4 days later you may peel. If you do the peel, you won't with the Fraxel. And a week after the treatment, you're going to notice a significant change in the texture of your skin.
Okay.
And you'll be pleasantly surprised, I think. Now, most people do a series of treatments. Just looking at your skin texture from here, I would probably recommend anywhere between 3 to 6 treatments.
3 to 6?
The average is probably 3. But again, it depends how strong I do it. Now, the first treatment we do, I'm not going to give you the strongest treatment.
Yeah.
Because you're not used to anything. But what happens most of the time is people will say on the next treatment, turn it up, give me a stronger treatment.
Oh, so because they're used to it.
Because they're used to it. The second treatment, really, they see it's not, they were a little bit anxious, they were scared, now they realize it's not uncomfortable. And then after they do the second one, they say, that's the one I want. Or you can even turn it up more, Dexter. Because you're gonna,
Full power.
but you'll see a lot of smoothing
Okay.
with one treatment, and it'll be a significant difference. And like I said, it could be 3 treatments you want. You might want more. You might only need 2 treatments.
So it just depends on the results